Well, state leaders have said from the earliest days of the pandemic that data would be the key driver in decision making. Newly released study results provide the clearest picture to date about COVID-19 in Indiana, according to Hoosier public health experts. And Business of Health reporter Kylie Veleta is here now with more. Kylie.
Thank you, Gary. The Indiana State Department of Health and the Fairbanks School of Public Health at IUPUI are releasing the preliminary findings from the first phase of a scientific study to measure the spread of COVID-19 in Indiana. This first wave randomly sampled nearly 5,000 Hoosiers. Here to highlight some of the most important findings is Dr. Nir Menachemi, professor and Fairbanks Endowed Chair at the Fairbanks School of Public Health. Dr. Menachemi, thanks for being on the show today.
Thank you for having me.
This study is getting national attention. So before we talk about the key findings, explain why this study is so meaningful, even on a national scale.
So, it all comes down to testing. And right now, by and large, almost all the people that have been tested for COVID-19 have been symptomatic or other high-risk individuals. Because we started off by having a limited number of tests, we had to prioritize it to the people who were the sickest or at highest risk. And so as a result, almost all the information we know about the disease comes from a very limited population. We know that there's an asymptomatic version of the disease that lots of people could be infected with, and we know almost nothing about those people. And as a result, it becomes very difficult to know what the true mortality rate is or how many people have been infected if we're only testing a limited number of sick people.
Okay, so let's drill down to Indiana. It's easy to get lost in the numbers and understand what they all mean. What are the biggest takeaways from this study?
So one of the biggest takeaways is that less than 3% of people in the state have been infected by the end of April. So lots of folks thought that maybe because the healthcare system had been challenged. I don't think we toppled over the healthcare system like we saw on the news in New York City and in other areas of the world, but we certainly challenged the healthcare system. And as a result, people thought that maybe a greater number of people would have ultimately been infected for that to have occurred. But it turns out our overall population prevalence was pretty low, suggesting that the vast majority of people in the state are still susceptible to infection.
All right, and given our business audience, let's focus on that angle for a minute. What is the message to state leadership as they're making decisions that impact Indiana businesses? And what's the message for employers and business leaders in Indiana?
So I think we bought some time. All the hunkering down that I think came at immense personal, economic, and other costs to everyone involved bought us some time. I like to think about it as we just won a small battle in this ongoing war with the virus, but the war is not over. I think employers are now going to increasingly play a larger role, given that we're slowly reopening the economy. There's a need for hypervigilance, especially by employers who have employees and customers to be thinking about. If we not adhere to the absolute highest vigilance of public health and hygiene and all the different things that we know can slow the spread of the virus, we might lose the ground that we gained by hunkering down.
Okay, just a few seconds left. What is phase 2 going to tell us when that starts in early June?
Phase 2 is going to allow us to see, after we open up businesses and slowly move the economy out of park into drive, how much the virus has spread, how many more people have become infected, how many people have been infected and recovered, and it'll tell us how well we're doing at that point.
Okay, Dr. Menachemi, thank you so much for joining us today. We're already out of time. Great study, and thanks for sharing it with us. Gary, back to you.